Hello and welcome. Today we're diving deep into the world of bladder stones, those hard, mineral masses that can form within the urinary bladder. We'll explore what causes them, how they develop, who's at risk, and most importantly, how they're treated and prevented. So, let's get started. What exactly causes bladder stones? Well, in most cases, they're a result of the bladder not emptying completely. This incomplete emptying allows urine to concentrate, leading to the crystallization of minerals. Several factors can contribute to this, including enlarged prostate glands in men, nerve damage that affects bladder function, bladder inflammation, and even the presence of foreign bodies in the bladder, like catheters. Now, let's look at the pathophysiology, or how bladder stones actually form. Imagine a tiny crystal acting as a seed. As urine sits in the bladder, more and more minerals like calcium, phosphate, and uric acid attach themselves to this seed. Over time, these layers build up, much like layers of an onion, eventually forming a larger, harder stone. The composition of the stone depends on the specific minerals present in the urine. Bladder stones aren't rare, but they're also not the most common urinary problem. They're more prevalent in men, especially older men, due to the higher incidence of prostate issues. People with neurogenic bladder, that's a bladder that doesn't function properly due to nerve damage, are also at increased risk. Certain dietary factors and underlying medical conditions can also play a role in who gets bladder stones. So, how do you know if you have bladder stones? The signs and symptoms can vary, but some common ones include abdominal pain, difficulty urinating, frequent urination, a burning sensation during urination, blood in the urine which can make the urine appear pink, red, or brown, and even cloudy or dark urine. Sometimes bladder stones are small enough to pass on their own without causing any symptoms at all. Diagnosing bladder stones typically involves a combination of physical examination, a review of your medical history, and imaging tests. A urine test, or urinalysis, can detect blood and infection. Imaging techniques like X-rays, CT scans, or ultrasounds of the bladder can help visualize the stones and determine their size and location. In some cases, a cystoscopy, where a small camera is inserted into the bladder, may be necessary for a closer look. While there aren't strict types of bladder stones as in other kidney stone classifications, bladder stones are often classified based on their composition: calcium stones, struvite stones, uric acid stones, and cystine stones. The treatment approach can vary depending on the stone's composition and size. Treatment for bladder stones aims to remove the stones and relieve symptoms. Small stones may pass on their own with increased fluid intake. Larger stones, however, often require intervention. Cystolitholopaxy is a common procedure where the stones are broken up into smaller pieces using a laser, ultrasound, or mechanical devices and then suctioned out. Open surgery to remove the stones is rarely needed, but may be necessary for very large or complex stones. Antibiotics may also be prescribed to treat any associated urinary tract infections. Preventing bladder stones primarily involves ensuring complete bladder emptying and staying well hydrated. Drinking plenty of water helps dilute the urine and reduces the concentration of minerals. Treating underlying conditions that contribute to incomplete bladder emptying, like enlarged prostate, is also crucial. Dietary modifications may be recommended to reduce the formation of specific types of stones, based on the individual's stone composition. The prognosis for bladder stones is generally good with appropriate treatment. However, recurrence is possible, especially if the underlying cause is not addressed. Recent research is focusing on developing less invasive techniques for stone removal and identifying specific risk factors to allow for more targeted prevention strategies. Maintaining good hydration, managing underlying medical conditions, and following your doctor's recommendations are key to staying bladder stone free. Thanks for watching!